The World Health Organization has declared a global pandemic over the new coronavirus, which causes an illness officially known as the COVID-19. This illness has spread to at least 153 countries and territories, infecting over 200,000 people and killing more than 7,900 people worldwide. How is the world responding to this pandemic? Is there already a vaccine against this disease? If you're still ignorant on how the COVID-19 manifests, here is what you need to know. The most common symptoms of the COVID-19 are fever, tiredness, and dry cough. Some patients may have aches and pains, nasal congestion, a runny nose, sore throat, or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected but don't develop any symptoms and don't feel unwell. Most people, about 80%, recover from the disease without needing special treatment. About 1 out of every 6 persons who gets the COVID-19 becomes seriously ill and develops difficulty breathing. Older people and those living with underlying medical problems like high blood pressure, heart problems, or diabetes are more likely to develop serious illness. People with fever, cough, and difficulty breathing should seek medical attention. Hey, if you're new on Healthy Habits channel, don't forget to subscribe. Is there a vaccine available already? To date, no vaccine has been officially approved by the World Health Organization. Don't be deceived by people who claim to have a vaccine and want to sell them to you. But there is hope as for what concerns vaccines. Possible vaccines and some specific drug treatments are under investigation. They are being tested through clinical trials. WHO is coordinating efforts to develop vaccines and medicines to prevent and treat the COVID-19. As of March 17, 2020, the first vaccine clinical trials began in the United States. The phase 1 of clinical trials for a potential COVID-19 vaccine has begun in Washington, USA. The first participants have received their first doses of an experimental vaccine developed through a partnership between the U.S. National Institute of Allergy and Infectious Diseases and Moderna, a biotechnology company based in Cambridge, Massachusetts, USA. But although it is an important milestone, the phase 1 trial is just the beginning of a long process to test the drug's safety and efficacy. Over the next 6 weeks, participants will receive their first doses, followed by a second 28 days later. Follow-up visits, both in person and over the phone, will assess the participants' health, and blood samples will help researchers evaluate the body's immune response to the experimental vaccine. But how long will the whole process take? Weeks? Months? Years? We are still to know. Let's just be optimistic and continue to practice safety measures both at home and out of our homes. If you still don't know how to stay safe and prevent the spread of the COVID-19, you can watch our video, Basic Preventive Measures for All. Here are some few facts known about the COVID-19 as from mid-March 2020. 1. The COVID-19 can spread from person to person through small droplets from the nose or mouth, which are spread when a person with COVID-19 coughs or exhales. These droplets land on objects and surfaces around the person. Other people then catch the COVID-19 by touching these objects or surfaces, then touching their eyes, nose, or mouth. 2. Swallowing or gargling with bleach, taking acetic acid or steroids, or using essential oils, salt water, ethanol, or other substances. None of these recommendations protect you from the COVID-19, and some of these practices may actually be dangerous. 3. A face mask is not recommended for people who are well to protect themselves from the COVID-19. The truth is, face masks should be used by people who show symptoms of the COVID-19 to help prevent the spread of the disease to others. This implies that face masks should be used by health workers and people who are taking care of other people in closed settings, could be at home or in a healthcare facility. 4. The COVID-19 is caused by a virus, so taking antibiotics is not going to help you in any way because antibiotics have no effect on viruses. 5. Unfortunately, it is not possible to predict how long the outbreak will last or how the epidemic or pandemic will unfold. We are dealing with a new virus and therefore a lot of uncertainty remains. So that's it, guys. Stay informed on the latest developments about the COVID-19. Follow advice given by your healthcare provider, your national and local public health authority, or your employer on how to protect yourself and others from the COVID-19. They are best placed to advise you on what people in your area should be doing to protect themselves. Keep practicing safety measures at home. Teach them to your children and friends. Thank you guys for watching. Don't forget to hit the like button and to share this video with your friends and family to help keep them safe. Also, subscribe if you haven't done so. And hey, I think it's time to go wash your hands.